Good morning, LinkedIn Live. How are you doing? It's Friday. How's your week been? We were just saying, Dudley, it's been a tough week, right? Busy,
Yeah.
lots going on, all of that sort of thing. And we're talking about a really important topic because DE&I in health and social care. So something that probably affects all of us, or at least family members, or we know somebody that is either on the receiving end of care, or we at some point in our lives, I guess all of us, are either born or leave at the other end of hopefully a long and fulfilling life. So Dudley, thank you so much for joining me today. Morning.
Morning to you, and thanks for having me.
You're welcome. So, for those that don't know, please go and check out Dudley's profile. So, Dudley is the owner of People Care Services, which manages services and offers consultancy to ensure that the UK social care providers are, sort of like compliant and are, really championing diversity, equity, and inclusion. So, it's compliance with things like the CQC, which, for those that don't know, is the Care Quality Commission regulations, and also local authority guidelines, especially I guess when it comes to the social care bit, right? Because that's the bit that's mainly driven by local authorities, right?
Indeed.
So to start off with the fact, we're going to get into this conversation in terms of what D&I means holistically in terms of for employees that work in the sector, but also for the local community, service users, clients, patients, etc. But just to start off with a little bit of a fact, because one thing that we're going to get into is the representation of men in this sector in terms of working in this sector. And a stat that I sort of came across a while ago was of the 693,000 registered nurses in the UK, just over 80,000 are men, so just over 11%. So it's a pretty low number. One of the things that we were saying when we were prepping for this before, Dudley, is that there are slightly more in mental health. So in mental health nursing, which there are just shy of sort of like 100,000 mental health nurses, and approximately 1/3 are male. So a slightly better proportion, but still there is this slight gender balance, possibly to do with the word nurse. But we'll come on to that because, if you Google what does the word nurse mean, you
Yeah.
possibly end up with a breastfeeding mother. So that maybe doesn't help in is a very gendered word, right? The word nurse itself. So let's start from the top, Dudley. Why is this so important? Why are you a D&I champion? Why is this topic so important when it comes to health and social care?
Thanks very much for setting the scene. I think it's quite interesting. I always love stats sometimes when it comes to sectors, and when you're trying to discuss why is this important, why are we talking about this? I think if you think about an industry, it contributed about over 55 billion towards the economy of the country last year. You're talking about a workforce, as you mentioned, which is over 1.52 million in size. So you've got that's that as one of the largest sectors, working sectors in the country. And so it has its importance in just size alone. But I think when we think about DEI now, and we think about it's essential for health and social care, especially having good diversity, because it makes sure that services provided to people are fair and accessible to everyone.
Yeah.
And as we know, COVID showed us that people should not be disadvantaged due to their background. And it's
Yeah.
quite interesting. And you spoke on something. People don't realize that we talk about going to the hospital. That's your first port of call when you're unwell or sick. But
Yeah.
anything that happens outside of the hospital is deemed potentially as social care. So looking after, for example, being in homes or being in a community, all of these things fall under sort of that guise of sort of social care. So people don't realize that, you leave the hospital, it doesn't just stop there. It
Yeah.
continues.
Yeah, and often, and I mean, there are so many angles that we could go down for this. But when you said about the size of the workforce, I can't remember if I put it in the post for this that the NHS, in terms of workforce, is one of the biggest workforces in the world, like
Yes.
literally in the world. It's absolutely huge. So, but as you say, in terms of health and social care, really does touch everyone. And so when we hear about things like shortages of beds, for example, some of that is sometimes because there isn't the care ready or the appropriate care ready out in the community to actually accept these people back in. So it really does touch everyone. And the two things, and I know this is something that the government's kind of trying to bring together a little bit more in terms of the closer working. The two things really have to dovetail for it to work well, don't they? What are,
Definitely.
there is as you were talking, it reminded me of healthcare inequalities. And you talked about COVID and how that affected different communities differently. What are your thoughts about then the importance of, the representation in the workforce and the impact on healthcare inequalities, whether that be physical health or mental health? What are your thoughts on that?
I think I think we've always looked at society as a whole, and we looked at the population. You hear the statistics, the ONS sort of data, but people don't realize as well. We drill down to healthcare and how that's distributed, and you talk about the different demographics, and we talk about socioeconomic status, talk about culture. Then we think about healthcare sort of expectancy, where people live. Their general health, sort of what the life expectancy of those around the country. And you drill down, and then you start finding that those, for example, who may not have a certain income are going to experience certain risks. We're talking about different rates of health, why people going to the hospital. And then we look at there as well inherent sort of conditions such as maybe diabetes and things like that. And you have a makeup of where and how the country is regarding health and life expectancy. And then it also helps of how you can maybe bring or improve things such as maybe diet or other things, exercise, that in itself, and why we like that. If you talk about COVID, which COVID showed, unfortunately, was that there was a higher rate of those who were from an ethnically diverse background who were susceptible to COVID or had passed away from COVID. And I guess the question that everyone will ask, why was the case? Does it mean that COVID was more prevalent amongst those individuals? But there's been various studies, and it showed that it could have been where they lived, because everyone was in close proximity, because COVID would spread a lot quicker if you live close to one another. Then you've got the notion of around people working on the front line were more likely to be those from an ethnically diverse background. So they were going to be more likely front facing and able to be able to, well, they were the ones who actually caught COVID because of that. So, going back to your point, there are, there's a lot of connections between socioeconomic sort of status and health. So it's definitely a big area to definitely be looked at, and it's growing as well.
As in, like, the disparities growing, do you mean?
Yeah, I mean, the disparities, I mean, I would, all right, growing in the sense of people were unaware. And what COVID showed was it created an awareness which people were not aware before. And before, you would never have thought that, for example, ethnically diverse community would have been more susceptible to COVID. Now people are asking questions, programs have been created. They've been more nuanced to look for that particular characteristic for a certain community, which wasn't done before.
Yeah, it's interesting, and you mentioned the word nuance, because actually it is quite complex, isn't it? And the data, it's not even necessarily, as you say, it's not even necessarily just as straightforward as its ethnicity or its gender or its, it's often it always comes back to intersectional. It's often a combination of factors, and it can be difficult to pinpoint the very thing. Is it socioeconomic status and deprivation? Is it ethnic? I remember once going for some blood work quite a few years ago. It's because, so a little bit of oversharing here, but when I'm very, very stressed, I come up in hives, right? So if you ever see me in hives, it means Cheryl's working too hard, right? And when it first started to happen, I was like, what's wrong with me? So I went to the doctor, had some blood work done. And when they tested like my blood sugar, it was slightly elevated. And they were like, oh, that's normal for people from an African Caribbean background. And I was like, is it really? Like, is it, or is that just a myth that's in the healthcare sector? Like, like Black women can experience more pain during childbirth. Do you know what I mean? It's like, is it real science, or have you just made it up? And that actually, for me as an individual, it kind of led me to try to be more empowered about my own health and to look into things like blood sugar and all of that sort of thing, because there are myths out there, about. So when I sort of joked about, Black women in childbirth and all, we know the stats, and there are myths out there about Black women being able to to take more pain for some bizarre reason. And unfortunately, some of these myths have sort of stuck. So that kind of probably links on quite nicely actually to our next question, which is something a term that you raised when we were prepping that I'd never heard of, which was culture-centered care. So do you want to just explain what that term is and why it's so important?
Well, for me, culture-centered care has been raising itself, and it's more relevant to this day, and COVID actually showed that. So for me, cultural-centered care emphasizes the importance of understanding and respecting cultural backgrounds and values of patients, clients, the community, but also considering not only the physical health, but needs of the patient, but also their social, emotional, spiritual well-being. This can lead to a more effective and appropriate care, or a sort of health sort of care that is tailored to the needs and preferences of the patient. So I'm sure we know improved communication, taking into account cultural differences, provides maybe better way of communicating with patients, building trust and leading to better outcomes. And for me, it creates and integrates the culture, the language of all involved in service delivery, organizations, customers, employees, care provided, and all associated environments. So it's the holistic point of view. It's, there's a big sort of phrase when they say person-centered care, which I think has probably been the go-to if you look at most health sort of environments. It's always about that person-centered. But what I found was there was a disconnect, because no matter how much you did person-centered care, if you don't understand about someone's background, their culture, then how personal can you get? So even before you reach and get to person-centered care, you're looking at their culture, so you'd know. And this has sort of shown itself in various ways. And I think the biggest thing I've seen, if we think about how individuals are, there was a case that took place recently, and what happened was a woman had suffered significant hair, diet, and skin problems with a nursing home, and they'd failed to meet her cultural needs because they hadn't looked at her diet, they didn't know how to comb her hair, they weren't oiling her skin, they didn't moisturize her skin. So if you didn't know about how someone likes to be treated, or the moisturizing of the skin, which is natural for example, those from an Afro-Caribbean background, most likely, then you're going to have the hair drying up, the skin's going to be ashy, and these are sort of basics.
Ashy, Dudley, you went there with the A word.
So even these things, and we're laughing, but it's something that actual family have to complain, because how can for you it's natural, your normal food.
I tell you why I'm laughing as well, because so my daughter, so I've got a 26-year-old daughter, as some people know, and for some reason I was never that massive actually on like the cocoa butter and all that. Let's really get into the stereotypes, right? But my daughter, when she then went to uni, she went to BCU, and she really sort of embraced. She's got like a whole like skincare routine. So sometimes when we're on holiday, things like, she looks at my legs and she's like, "Mom, your legs are so ashy." So that's why, she mocks me all the time for my ashy legs. So so if you see me, in real life and I have ashy legs, don't judge me. But it is really important. It's definitely important. Because that links on to like skin conditions actually. And again, I was literally talking to my daughter yesterday about this in terms of an understanding of skin conditions and how they present themselves on different skin types and all of that. So important.
No, I think it's huge, and I think as I mentioned the word nuance, but it's not so nuanced now, because we're now such a diverse society. So the chances are, if you, for example, lived in a part of the country, you're never going to come across someone from an ethnic diverse background. But the chances are now, the way things are, it's not just the big cities now, it's the smaller cities as well, where people and communities are growing, and it's learning from that. So I think it's hugely important in regards to that. So we're trying to sort of dispel, and going back to what you're saying, reduce health disparities, but improve health outcomes, health inequality. The more we know, of people and individuals, the less we fear, the less we are aware. So I think that's also an important factor when we think about it as well. So I think it's a huge thing for me.
It's brilliant. And culture, there's sometimes the word culture is is a necessary, almost like part of the nuance to add on to like ethnicity, because sometimes, you know, we just think of skin color, hair and eyes as sort of almost like defining who somebody is and what their preferences are, but actually it's more than that. It's culture, because you could have somebody from, you know, an African background and a specific country within Africa that recognizes certain you know, sort of practices and cultures
Yeah.
and all spirituality, and then you can have somebody from a Caribbean, but and it's completely different. There may be some crossovers and some similarities, but it could be wildly different. And interesting that you mentioned the spiritual aspect as well, because I think especially when it comes to mental health and social care in particular, and you overlay, you know, sort of spiritual beliefs in terms of, you know, what are the interventions that are available. You know, I come from quite a religious background. You know, I'm not practicing myself now, but quite a religious background, and so, you know, you wouldn't it wouldn't be appropriate for a mental health worker, for example, to suggest yoga or something. Like, I'm a big yoga fan, but you
Hmm.
know, my mom is like not into the, she's like, don't bring that near to me. Do you know what I mean? So understanding, you know, some of those things, and even attitudes towards things like therapy. You know, not all
Yeah.
individuals and some cultures are slightly more resistant. So understanding all of that is useful. Let's talk about men as well, because obviously, you know, we had the stats at the start, and when we think about the needs, you know, particularly, you know, mental health, and we had some very tragic news in obviously in Birmingham
Yes.
this week, you know, with the passing of
Yeah.
Wayne Brown, our fire
Indeed.
chief. So yeah, in terms of, you know, the needs of you know, men, and the fact that we don't have as much men in, you know, not just mental health, but in social care as
Yeah.
well, and what that looks like in the community. What are your thoughts about that, and how can we get more men into that space?
Well, there's like two big topics that are on horizon when we think about this space. And I know you're going to touch on another one in a minute. But yeah, the male side of things, and you touch on it about the inherent notion of becoming a someone in healthcare or a nurse. It's
Yeah.
always has that sort of traditional sort of mindset of you know, someone being a female or something like that. And I think it's
Yeah.
always sort of like hung around. But the expertise and knowledge is about actually trying to help those to improve their health and well-being. And you know, if you cared for your mum, if I cared for my mum, you know,
Mm.
there would be nothing. There wouldn't be a question because I'm her
Yeah.
son. It's just something I would do. But if we're now put in a professional setting, you know, you'd expect, for example, a nurse to come in and say, "What was she like?" Or you hear things like that straight away. So
Yeah.
I
Yeah.
think it's actually to dispel the myth that, you know, to work in a sector like this, you don't have to be female, and it's really about trying to provide a better life for
Mm.
someone,
Yeah.
improving them. So I think the reason why mental health is probably more popular is because it's more physical. So you're probably requiring, you know, I'm not going to try and fall down for this sort of like putting it into a stereotype, but
Yeah.
all sort of strength of of maybe males and dealing with maybe patients who may be
Yeah.
unrest or things like that. Or if you're talking
Yeah.
about learning disability and trying to help and move individuals. But
Hmm.
I think as well, you it's very hard to change mindsets. So I'm always a very positive thinking individual. So my thing is really putting campaigns where you're going to attract more males. So if we think about working with like football clubs have a huge range of support for those, for example, who are watching matches who maybe potentially have a
Mm.
disability. And a lot of the care workers or support workers that come there, some may be females, but a huge range are males. And males love, a lot of males love football or sports. And
Mm.
in that environment, you know, that's a way of coming into the sector and it can
Yeah.
improve. There's various other things you can do to support. So I think listen, it's unquestionable the stats don't lie.
Yeah.
It's about what can we do to attract more
Yeah.
people in.
Yeah.
And that goes, I'm sure you're going to raise another topic to those under the age of, for example, the younger generation as well. So
Yeah. Yeah.
the same thing applies as well in regards to that. And it's I spoke about changing mindsets.
Mm.
So we look at stats like about 8% of the sector are under 25, and it needs to improve.
Yeah.
And how do we do that? Do we look at things such as encouraging at school, looking at the different sort of when you're going into school, you look at sort of, I want to be a doctor, I want to, and a nurse, but how to encourage showing cases, showing individuals that look like you. I think the other thing definitely is if you see someone that you can look, that you can aspire
Yeah.
to, then
Yeah.
it's something you can follow.
Yeah.
So the other thing is, who are the famous people, for example, in social care or that they can relate to it. And I found that, especially during COVID, and probably being a voice in the sector,
Yeah.
we found that the government, when it came to COVID, it was about the vaccination. And there was I'm not gonna, like, we all know that there was a huge sort of kickback from the ethnic diverse community about wanting to take the vaccine, and there were very reasons, but for me it was more regards to do a lot to do with the trust factor rather than just the element of they didn't want to take it for one reason or another. And if you have someone who doesn't look like you, doesn't sound like you, telling you to take something and you don't trust them, then but then if I give you another conversation of how we can relate to each other, they went in, they looked at campaigns with mosques and into churches, and then they started to get people like that to speak to them towards the latter end of the sort of when it came to the vaccines. But before, they never did that. So a lot of the going back to culture centered care, it's about trust. It's about understanding someone who looks like you, sounds like you. So same with the younger generation, same with males. It's about getting people to relate the message to you that they can understand. And I think it's hugely important as well.
Yeah, it's really interesting what you say in terms of the campaigns and really thinking about what works, maybe maybe looking at, what other NHS trusts or other healthcare providers are doing. I think I said to you when we were prepping, there's an organisation that I sit on. It's basically like a small focus group that's called the Race and Ethnic Advisory Group. I'm going to say, I think that's what it's called. That's attached to King's College London in terms of their psychiatric research, and they come to us as a group, and it's a mixture of people with lived experience, family members across all ethnicities, black, brown, white, everything kind of thing, and they come to us to get advice in terms of how they can make sure that when these bits of research go out, particularly say, for example, if they're recruiting people to take part in research, how do they make sure that it's broad and they reach people? So there is something about either using focus groups, or I would probably encourage using, for example, if you have them, things like your staff networks. You've got staff networks of people that have been brought in, with different lived experience. It might be, ethnicity, disabilities, LGBTQIA plus. We were talking about this as we joined, and go into those groups and sort of say, we're thinking of doing this. What do you think would work for this community? And that's potentially, a way of sort of reaching out. But one of the questions I wanted to come on to is, this whole thing about how to get more people into the sector, because this is something I suggested when I sat on an NHS board. I did a short stint on it. I'll maybe do a LinkedIn Live another day as to why it was only quite short. But there for me, there was a question about, I know this sounds like a sort of grand idea, but does nursing not need a complete rebrand? As in, do we not just need a different name? As in, if people want to hang on to the word nurse for whatever reason, fine. Does there not need to now be a new name that's like healthcare something or other, that's not attached to such a gendered name? I just don't see how we're going to get past that. The word is so gendered, it's ridiculous, right?
Yeah, I think so. I think it's quite interesting, and I know we haven't got that long, but I think for me, I think I think we could wage a campaign about it. But unfortunately, when it talks about the NHS, it seems to rule. It's everyone around the world talks about the NHS, how huge it is, how big it is. You have the image of doctors and nurses, and I think to shake that, it's going to be a hard task. But you're right. I think creating a different mindset is important.
Or a different path. A different technical path that doesn't have the same name, and just target men and young people with this different, almost like a different qualification, but actually the same thing but a different name.
Yes, indeed. And I think I've been doing some work with various universities, have joined almost community, university, so academic, community, and sort of health itself. So you're creating a model where everyone is involved, everyone plays a part, and it's almost like that community kind of care that's been delivered. So it gives almost like, whereas before, you go out into your village or community and you see someone down the road, then that you're helping them, so it's all almost 360. And I think you can do things like that, and then it means then the stats where, you know, someone went to hospital, oh, we know why that person went to hospital, we understand. And then when they come out as well, we know how to support them so they don't go back in again, because that's happens a lot. So I think it's, as you said, it's creating a whole new image. I think that sort of old image is still sort of stuck in our head. If you were to close your eyes and someone told you nurse, doctor, we probably know what image comes to mind.
Yeah.
So it's
Yeah.
so there's that. So I think it's important. And I think as well, going beyond all of that, I think just outside of healthcare, because people forget a lot of the time that healthcare is also a business. It's a big business, and COVID showed that lots of big pharma got rich off healthcare. So in itself, it's the ROI for people is really important regarding healthcare. And for me, I also think the ROI isn't just for me the return on investment, but return on inclusion is what I call it when I say ROI, because it's about retention, it's about bringing people in, it's about involving those in the sector, different communities. So if your ROI is great, you're going to get health that works well. You're going to have engagement. You're going to have those sorts of things. And if I was going to have like an equation, it would be diversity plus trust equals engagement. So that would give and help, because the more you're engaged in your health, the more like you're going to talk about it. If you go to a GP now, I know GPs who just have a Google and sit there, but but actually, you probably know more what's wrong with you than they do. So and so you've got things like that. So I think it's really important to go beyond that. And then you know, going about DEI, we're talking about diverse communities now. So if we think about things like Windrush, and we talk about that generation, they're of an age now where they need care and support. So who is caring for them? We know that families don't have the same opportunity to bring mum or dad into a home, into their house. They're being cared for out in the community, being a care home or whether some form of supported living. So are you sure and confident that people are looking after them, have the knowledge, the recourse and the ideas of their culture and how to care for them and how to make their food and dishes? So I think those are really important for me. So ROI, consent and care, they all work hand in hand, providing a better outcome for the health for those as well.
I love that as well. Return on inclusion. I might have to steal that, Dudley. I really like that. It's great. Because often, actually, we sometimes I talk about return on investment. You know, my background, I am an accountant, so I sometimes talk about ROI in terms of the DE&I business case. But actually, I love that return on inclusion. Let's finish off just by we've touched on it a little bit. Representation further up in the hierarchy, and I'm guessing that some people might be listening to this, especially if you are in the healthcare sector. And when we talked about underrepresentation of men, some people might be saying, yes, but the glass escalator or the glass elevator, as they call it, whereby there is an underrepresentation of men at lower levels, but actually when you get to the senior levels, all of a sudden the representation of men is there, right? But we know that the representation isn't balanced in terms of, you know, socioeconomic status and all of that sort of thing. So tell us about why you think representation further up the hierarchy is important, and how we get the right people in the room.
Yeah, I think there's this case of boardrooms, and it used to be sort of like the average sort of boardroom person would be white, middle-aged male, and I think it's a thing that's always sticks with it. And I think it's still interesting, because I know when I'm in certain higher up in certain boardrooms or meetings, and I look around, first and foremost, obviously being a male in the sector is one thing, but being a black male as well. So you've got, you look around the room and seeing how do we bring those who maybe look like us, sound like us, or do we have more diverse boardrooms is hugely important. I'm going to flip it on its head, and I think you can't change the facts at the moment, but you can improve the facts. And how do we do that? So I remember speaking with Jo Myers, and she's someone who's very senior in sort of like the NHS, and she was looking at a case around people deciding about eczema, and they were making decisions around that. And it was a board that were put together, and she said to me, if she hadn't have been in there, they would have made decisions without her. She was the only black person in that board talking about a condition which they knew nothing about. So if you don't put yourself in those boardrooms or in those places, then decisions are going to be made whether you like it or not. So yes, the boardrooms probably couldn't do with a better representation, but we have to be in the boardrooms. We have to be present. We've got individuals like a woman who does Brave in the Boardroom. She does a series about how the boardroom looks, how diverse it is, how
Okay.
do we get more exec
Yeah.
into the boardroom as well. So
Yeah.
yeah, it's
Yeah.
a sad state of, it's not the greatest, but I think it's
Yeah.
on the up, it's improving, and I think there's going
Yeah.
to be more space of those having more diverse boardrooms as well.
Yeah. I think also I want to tag on to that, because something that you mentioned just before we came on live. So we're talking about international recruitment and all of that sort of thing, but LGBTQIA representation in boardrooms as well, I think in those decision-making spaces is quite important. Because I think, was it in a conversation with you, we were talking about end of life
Yeah,
and how that impacts individuals that,
yeah,
aren't in what's considered like, a sort of heteronormative
yes,
partnership can be quite challenging, and having healthcare and social care providers that
yeah,
understand what those needs are. But then also, when we think about gender, and there's no way we've got time enough to go into that, but when we think about gender and trans individuals, in terms of both the needs of that community, but also understanding how that impacts on the data, and how data has to be managed and collected. There's a brilliant YouTube video out there. If I remember, I'll drop it in the comments. But there's a scientist that basically talks about the importance of data in terms of being able to serve those communities properly. Do you know what I mean? By understanding the data, it's fascinating. But it all, I think you're right. It stems from making sure that the right people are in the room, and really good representation, really good cross section. And again, I would say, if you haven't got that straight away, because you can't all of a sudden just
yeah,
hire another 10 people to join your board, right? So
yes,
you've got
exactly.
to, reach out to the focus groups, to the staff networks, and get these staff networks doing some real
Yes,
work, get
yes,
them involved in these strategic level conversations, because that's what they're crying out to do. They don't want to just be running event awareness days.
yeah,
They want to be doing real stuff. So I would definitely say use those resources.
yeah.
Um,
I agree. I think just to chime in there, DEI, it does matter. Health matters, but DEI matters
yeah,
within health. So anything that can help us have a better health is better for the economy, better
yeah,
for us as people, and helps with more the mindset and learning about cultures and
yeah,
differences. Really is the way of caring going
yeah,
forward.
absolutely. Perfect. Any final tips from you, Dudley? So if somebody's watching this and they work in health or in social care, and so they're thinking about, how can we get this more on the agenda? Is there anything that we can do, even just to start? Apart from reaching out to you, obviously, in terms of the
Yeah.
amazing work that you do, where should they start? What should they sort of like be looking to start with?
So one thing I do a lot of training, I work around things such as food, music, and I think the basics, go down to the basics, something that gets people all talking together, get them in the room
Yeah,
together, share ideas. I think sometimes you've got to be very careful with meetings over meetings, but it's actually the actioning of the meetings.
yeah,
I've written something around 5 steps about, awareness, education, action, integration, then finally sharing. So actually
mm,
getting them in the room, getting them to speak out, because the long run, it's going to get
yeah,
people speaking, supporting, knowing each other, and helps people stay in workplaces more. So retention is a fact of the matter, better healthcare.
mhm,
So all these sorts of things are important, but you can start with yourself. Every journey
yeah,
starts with yourself. Then you can start looking around you and actually share be who you are, but bringing
yeah.
to support those who are there as well, being who they are as well.
Yeah, I love that. Thank you so much, Dudley. And food and music, I must, often when if I'm doing like online stuff and I'm putting stuff in an icebreaker, I often, talk about, what are you listening to at the moment? Because it's a little window into, into some of our preferences and who we are and those sorts of things. It's a really good way to connect just on a human level.
Yeah, when I do training,
So
it definitely plays a big part. And the amount of different types of food that I hear in the morning or when I'm training, it this makes me so happy. So
really.
yeah, so it's a
Yeah, it's true. Honestly, I'd recommend. Do you know what? Any DI consultants out there? I did a workshop last year or the year before, I can't remember, to a group of Swedish retailers, right? And I shared a picture of what I'd been cooking at the weekend, because I'd had some family around for bank holiday, and I don't often do it, but I'd done,
yeah,
plantain and ackee and saltfish and this. And so I was sharing the picture, because I was expressing to them and explaining to them the importance of food in culture. And obviously, as retailers, you know, they're Swedish greengrocers, so they're retailers. So we
Yes,
were just talking about the importance of food in our heritage and when it comes to culture and all of that. So I definitely recommend it to anybody. You know, we sometimes mock that DEI is reduced to food, but actually food is very close to our hearts, right?
oh
And
yeah,
it's a window into who we are sometimes. So Dudley, thank you so much for joining me. It's been amazing. You know, if anybody wants to find out more about what Dudley does, please do reach out. If we remember, we will drop in some of the links to some of the things that we mentioned. Yeah, and if you're in a staff network in an organization like this, you know, put your hands up, maybe, you know, go, if you hear of different initiatives or whatever, you know, go and put your hands up and ask to get involved in these sorts of conversations, because I'm sure they'll be appreciative of that support. So
definitely.
Dudley, thank you
Thank you
once
very much for that.
again.
Thank you for that as well.
Amazing. Thank you for listening if you're listening live, and thank you if you're listening on the replay. Take care.